Hi, I'm Lisa Leiter. In your Friday edition of Chicago Business Today, Swedish Covenant Hospital. Healthcare reforms and financial pressures are forcing many hospitals to consolidate. But Swedish Covenant Hospital on Chicago's north side is braving a go-it-alone strategy. Chief Executive Mark Newton has doubled revenue in his 10-year tenure and has grown the hospital's share of the market to almost 40% from 27.5% in the year 2000.
The biggest pressure we have is really those uncontrollable things that would be occurring legislatively in terms of affecting our reimbursement. Clearly, without doubt, that's really the most critical uncontrollable element. There is a great risk that in healthcare reform today we will lose the perspective of the individual patient. And aside from those things that I don't control, the one thing that we do control and influence is what are we doing for the patient today.
What Swedish Covenant has done invested in technology and expanded facilities, but Newton has some big challenges. The hospital lost money last year, and this year's expected profits could disappear if several $100 million in newly proposed state Medicaid cuts go through. About a third of Swedish Covenant's patients are on Medicaid or uninsured.
The one component about healthcare reform that I think is still very much unanswered is how does it affect the individual consumer? And the individual consumer has not had the benefit of really understanding their role in healthcare reform, how it's going to affect them, how it's going to affect their insurance choices. And that is kind of the one unanswered question of healthcare reform that still concerns many of us.
No doubt, Newton says there will be hospitals that close because of the proposed cuts, which he says could slash Swedish Covenant's revenue by $2 million. To avoid that fate, he has built nearly $137 million in cash and investments, enough to cover more than 6 months of operating expenses, more than other safety net hospitals.
We've been constantly taking costs out of the system and trying to get much more efficient.
Newton is the only community hospital executive to serve on new Mayor Rahm Emanuel's Health and Human Services transition team. And that's this edition of Chicago Business Today. You can read more about Swedish Covenant in this week's print edition of Crain's and on chicagobusiness.com. Thanks for watching. Have a great weekend. We'll see you on Monday.